Hello, now we will deal with this scary virus called coronavirus. Let's look at it. Epidemiology means statistics. Let's look at the statistics. Which disease does this coronavirus cause? Which disease? Pneumonia, so lung infection. Remember this. Coronavirus causes lung infection. And this is nothing rare. Lung infection is treated every day in almost every hospital, okay? It's not rare. Which two severe diseases can it cause? This is something that is more rare. It's severe acute respiratory syndrome and Middle East syndrome. We will see severe acute respiratory syndrome. I will not deal with these syndromes specifically. We'll do another video about that. How many patients develop an acute respiratory distress syndrome, do you think? 30%, so it's pretty high. So this coronavirus can cause acute respiratory distress syndrome in 30% of cases. 1/3 of patients. And why is this important? Because this syndrome is very dangerous. This can kill you. And this is why coronavirus is so dangerous. It's not because it's causing a lung infection. Lung infection is very common. It's every winter you see many people with lung infection. The problem is that it can cause acute respiratory distress syndrome in 30% of cases. How many patients of those acquiring this acute respiratory distress syndrome requires a mechanical ventilation, meaning you need to have an intubation? 10%. And intubation means that an anesthesiologist would put a tube into your lungs, and we will monitor this patient, all the things that you will be given oxygen through this tube. You will have all the monitoring that you have by the anesthesiologist. And 10% requires mechanical ventilation of those that had acute respiratory distress syndrome. So about 1/3 of patients get this type of syndrome, and about 1/10 of these patients will get a mechanical ventilation. And this is the scary part. Middle East respiratory syndrome, this is also a very severe syndrome, and this can also be deadly. So these two things are the most severe diseases that can happen. How long do you think is the incubation period of coronavirus? About 1 week. So we have 1 week, approximately. Sometimes it can take 2 weeks. Sometimes it can take 3 days. So in general, in average, 1 week. Remember that. And that means you are affected now, and nobody will see it. You will not find it out, and nobody will find it out. Only after 1 week. And then you have already infected a lot of people, and this is the danger. So how many patients develop a severe disease? 20% develop a severe disease. Severe disease. We said that 30% can develop this acute syndrome. Yes, so you see, there are different statistics, but severe disease is also 20% being this. This is included in that, and as you see, the statistics that we will see in many charts will be all different. So, and why is this? Because this virus is so new, and this is one of the things I want to highlight here, that you cannot really rely on all these statistics. Because I talked about 30%, and now I talk about 20%. You see? Discrepancies already. Because this virus is not more than half a year, or no, a couple of months ago it happened, okay? So this is a very new disease. And the 3 severe outcomes of disease can be the things that we said: respiratory failure, we have septic shock, and organ failure. So these three things will be the most severe cases, and therefore these patients can die. And who is it affecting? Usually elderly people. Which types of patients died from this infection? Those with already other severe diseases. This is very important because many patients are afraid of this coronavirus, but actually it affects older people and those who already have very severe diseases. Or, I highlighted here, medical staff. And this is dangerous. So it can be a young medical doctor like me. I could get this coronavirus, I could get infected, and I could also die. It's very rare that it would happen, but it have happened, okay? And that is the danger. So you see here we have a patient with her doctor, and both can affect each other, and both can actually die. Because doctors and nurses are all in contact with all these people. And let's say a doctor will meet 3 or 5 or 10 patients with coronavirus, and this all accumulates, and this doctor will then be very sick. In which city is the newest outbreak of coronavirus epidemic happening? So this Wuhan city in China was the start of everything. Okay, this was the start. So here you see China, and this is the start of everything. But remember, coronavirus is already known. It's not a new virus in itself, but the type of the same virus is different, because molecules can change a little bit, and the coronavirus, it looks the same, but it's a little bit different. It's much more stronger and much more dangerous, because coronaviruses actually is so common in the world. It happens every year, every winter. So it was last year also, it was 2 years ago, 3 years ago, and nobody talked about it, because it was a coronavirus that is not so strong. It was a weaker type, and this one is really strong. And how is it possible to get this corona infection? So you travel to this city, Wuhan, or nowadays it's so outspread, so you can travel to Italy, or you can travel to South Korea, you can travel to many other places and get affected. That's the problem. And the close contact that you have with a patient when you're sitting next to somebody in a flight, or you don't actually need to sit next to him. It's actually enough if you only speak with him 10 or 15 minutes. He don't have any mask. He speaks with you, and he's very close. And of course, you should have a little bit distance to people. Don't be 1 meter apart. Be 2 meters apart. Unfortunately, this is very annoying, I know, and it's very awkward to talk with people like that. But please make a little bit more distance, because this will go through the air and it will hit you, and then you will be affected. And especially those people that you don't know, or those people that you know who travel to these areas, please don't talk with these people in such a close contact. Okay? What is being done at the airports to prevent this outbreak? We screen people at the exit of the travel from these areas. So people come, and then we will screen these people, we will make some tests. And if we suspect anybody having it, or if we find anything, we have to actually make a quarantines. We need to close these patients, otherwise they will affect many more patients. And actually, it has been said that 1 patient can, in average, affect 3 new ones. And therefore, it's spreading exponentially, because it's 1 person affecting 3, then these 3 are affecting 3, that means 9, and so on, and the math goes on, and it's exponential curve. What is this new coronavirus called? It's called 2019, because it's happened in 2019, NCOV. Okay, this is the name of it, and the mask that you see here is something that people believe will prevent them to getting this disease, and that's unfortunately not the case. This mask will not help you, because this mask, all the particles are going through this mask, and also from the sides. This is not insulated. It's not like so tight around your mouth and your nose. And the problem is now, many surgeons have said this nowadays, that they cannot even find surgery masks for themselves when they are operating, because all the people are buying them, and there's a deficit of this. So surgeons cannot operate anymore because they don't have any mask to put on. And why is this annoying? Because it's annoying because we know that this mask, this surgery mask, will not help. So please don't buy this type of mask. If you want to buy a mask, then you have to buy something called N95. N95, it's insulated. Your mouth and your nose are completely insulated, but this mask is usually only good for, I would say, you would maybe manage to have it on for 1 hour, and then you're exhausted, because you cannot breathe so well with this mask. There's a filter, a small filter hole, and you cannot really breathe through this mask, and therefore it will be really difficult. Your lungs have to work against this pressure, because no air is allowed to go out from this part, only through this small filter. And this is not really funny. Okay, so please, I would rather recommend don't travel to these areas. And if you find out that the coronavirus is really high in your city, please stay home, get sick leave, I don't know, but the best advice I have is to somehow isolate yourself from the potential infection. Okay, so this coronavirus is different. It's completely different, as we said. Where were the first cases detected? In the seafood market, as we said, in seafood market in Wuhan, China. And this virus can be transmitted both from animal and human. And that's also dangerous. So not just humans, but animals can also infect humans. Is it only possible to be infected by contact with a person with an active infection with symptoms? No. So many cases were due to asymptomatic patients. And this is the dangers, you think. Asymptomatic patients mean that you don't see any symptoms of these patients. And therefore, people start to become so paranoid because they don't know who have corona, because many people are asymptomatic or no symptoms for 1 week. So why is this fact that the transmission can happen from asymptomatic patient dangerous? As we say, you never know who has the disease, and therefore it's hard to prevent yourself. You never know. It can be your friend, your wife, it can be anybody. What human subtypes of coronaviruses exist? Alpha and beta. Alpha and beta coronavirus exist, and this type of coronavirus that is so outspread now is beta coronavirus. Beta coronavirus. And these viruses are called coronaviruses because they have a crown-like appearance on electron micrographs. So we can see this virus in electron microscope, and it will look like this. It's a very beautiful three-dimensional picture of this very dangerous virus. So this is how it looks like. What type of virus is a coronavirus? It's an RNA virus because there exists RNA and DNA and other types of viruses. And this has the largest genome. So the gene itself, the largest genome is in these coronaviruses. See, corona and the genome is inside there. When did this outbreak begin? End of 2019. So it began in end of 2019, and the people affected until now, and these statistics will increase further with time, but at the moment around 90,000 affected and 3,000 deaths. And this means that we have around 3.3% death rate, and that's very, very high. Unfortunately, I would say this is really, really high. 3.3, that means out of 100 people affected, 3 of them will die. That's really high. Okay, so if you see how many patients or people we have in China, and if this could spread more, then many, many people would die, because 3% is a very, very high number. How do this coronavirus outbreak compare to other viral outbreaks? So now I have made you become a little bit, you feel fear now. As the news are saying, this is very dangerous and so on, you can die. And now we come and we start to compare the virus compared to other ones. Let's look at you have year here, 1967, and then you have Ebola, 1976, and so on. In Ebola, we had 33,000 cases, we have 13,000 deaths. That means a 40% death rate. So I said that 3% was really, really high. And now we start to compare it with the other ones. And let's look at the one which I highlighted there. H1N1 that we had in 2009, 1.6 million people affected and 280,000 deaths. That means we have a 17.4% death rate. Compare that to this 3%. It's more than 5 times. If you take Ebola, 40, it's more than 10 times as dangerous. The Ebola was more than 10 times as dangerous. As you see here, in 1976, we had Marburg, 80% fatality rate. Can you believe this? The only difference here is that the cases was only 466. That's the difference here. In this new coronavirus thing, we have 90,000 affected. So it's a pretty lot. And 3% is actually, compared to these ones, not so high. Not so high. How did this coronavirus spread to the rest of us? Due to air travel. We have dealt with this. So we need to stop the air travel to these areas. And if you don't stop it, or if you don't control patients who are coming from these areas, this will make a huge outbreak. It will be really, really big. And about how many percent of those affected live in China? More than 99%. So actually, almost everybody affected lives in China. And now it starts to move to other parts of the world because of flight, because of air travel. In comparison, how many people were affected by the influenza virus in the United States only in 2018? So now my purpose is here to make you a little bit calm, okay, calm you down. Influenza virus, you know what that is. In 2018, in United States only, not in China, not in Europe, not in everywhere else, only in United States. This is also a virus. Please, influenza virus is also like a coronavirus. 48.8 million people were affected in United States. Not 90,000 in the whole world. 48.8 million people in United States. Okay? And if you compare this to this coronavirus, it's a joke. Like, it's huge difference. If you know numbers, you know it's a huge difference. 80,000 died in United States in 2018 from influenza. Have you heard about any news about this? Why is this huge, big thing about coronavirus? Coronavirus kills 3,000 people in the world, and in United States, it killed 80,000 only in United States. So, what is the conclusion? Did you take a mask on just because you had influenza time in the United States in 2018? No. That's what I mean. Of course, it's dangerous. Coronavirus is dangerous. But if you compare it with influenza, it's nothing. It's really nothing. And then somebody will ask, but what is this hype about? Why are everybody so afraid? That's because the difference here is that the ratio from 48.8 million people affected and 80,000 deaths, the percent is like 20 times less. So one can say that coronavirus is like 20, I don't know them, I haven't calculated actually, but it will be around 20 times more death in coronaviruses compared to influenza. And that's actually the main difference between influenza. But in general, influenza is affecting many more people than coronavirus. So in general, one can say influenza is more dangerous. So, and influenza, we know we will take yearly vaccination, and please make that. I did it. I didn't get any influenza this year. I didn't get any influenza last year. I didn't get any influenza three years ago. I didn't have anything. Why? Because I took the vaccination. Every year, please take it already in the summer and I would say summer, autumn phase, like August, September. You could take this influenza vaccination, and you will not get anything during the winter. Okay, it's not 100%. You can get it also with the vaccination, but you will reduce it drastically. So please take this vaccination. Don't be afraid from vaccinations. Symptoms. Which are the symptoms? We have fever. That's a typical sign of almost all viruses. So these symptoms are very general. We have fever, we have cough. We have that with influenza also, so it's nothing different. We have dyspnea, so difficulty breathing. We have myalgia, so pain in our muscles. We have fatigue. These are very general things, as you see. Remember these symptoms: cough, fever, fatigue, difficulty breathing, pain in our muscles. Diagnostic test in the lab that we can do, we can detect the virus with polymerase chain reaction. It's called PCR, polymerase chain reaction. And this has to be done if you want to diagnose coronaviruses, because other tests cannot do it. And the lab test that we can do from blood, this is very unspecific, but we can see a lymphopenia, which means that we have a lower amount of lymphocytes. As you see, this white cell that I have drawn here, this is a lymphocyte, and we have less of those white cells in coronavirus infection. From where can we take specimens? Because we need to take specimens if you want to find out if we have any virus or not. Sputum can be taken, so sputum, and then you take from this saliva and so on, and then we can check it with PCR and so on tracheal aspirate can be taken. This is a little bit lower down because this is a respiratory infection and it can affect the respiratory tract a little bit lower down. Bronchoalveolar lavage, this is even further down. If we see that this patient has a severe pneumonia and we cannot treat it, then we will take an bronchoalveolar lavage very deep, and this has to be through a tube, and this is very rarely done. But with severe patients, we need to do it. Nasopharyngeal swab can be taken from the nasal region, and then of course from blood. And all the specimens can be taken from the blood. It's easier, of course, it's fastest. We do a PCR from this also. Good. Imaging, X-ray, bilateral infiltrate can be seen. So it means that we have an infection, an inflammation in the lungs, and it's in both sides of the lung. And this can be seen with an X-ray, or we can go further and we can do a CT scan of the chest. CT scan can show ground glass opacities. This will be some consolidations, as you can see there. If you're not the radiologist, it will be hard to describe this, but as you see, there are like small patches, small consolidations of fluid or of inflammation that you can see, and also subsegmental consolidation. This is almost the same thing, but you have it in some segments of the lung, and it's the sub-segments of the lung. If you're not a radiologist, you don't need to know this. Multilobar consolidation, meaning in many various lobes of the lung, because lobes have many different lobes. The lung have many different lobes, and you can see here you have a lot of consolidation. So that was in the CT. The treatment that we can do is glucocorticoids in patients who have COPD. So generally we don't give glucocorticoids in viral infections, but it can be given in COPD. So in viral infection, usually, as I have written here, it is causing increased mortality actually and delayed viral clearance. So don't give corticosteroids only if you have COPD. Please remember that. And here I have said that COPD, this is a narrowing of the airways, and this is usually seen in smokers. So if you're a smoker and you have COPD, then you should get your glucocorticoids. Otherwise, it's not good against viral infections. The treatment of the disease, otherwise, is immediate isolation. So it means that you have a case and you immediately isolate the patient in the hospital. And this is special rooms actually. If you don't have it in your hospital, if you don't have these vacuum filtered rooms, then it's enough if you only isolate the patient, but then you have to take really care of the hygiene in the hospital. Infection control measures, of course, this will be the guidelines that we have, the hygiene that we do, and so on. The infection control can be, for example, that we have this room that I talked about. This is a negative pressure room with filters, HEPA filters, okay? And this does not allow any viruses in and out. It's completely isolated room. Then we have gloves and eye protection. This is required, okay? Gloves and eye protection. Then we have safe disposal of the materials that were in contact with this patient. And this is very important because the disposal of materials cannot just be put anywhere, because that can also affect everybody else in the hospital. Transport should be minimized, so don't go around with the patient. Please, I would suggest don't go to the CT, don't do an X-ray, don't go through the hospital. If you need to do an X-ray, then take the X-ray machine to the room instead, and then you disinfect the whole machine. You get the point. Don't move the patient around, because there are many severely ill patients in the hospital that can die. Okay. Proper hand hygiene. This is very important before contact with the patient, after contact with the patient, after any contact with the material of the patient, after contact of any saliva or any blood of the patient, after contact of anything that had with the patients to do with. Yeah. These are the things. The treatment of disease can also be, we have to, of course, contact the public health officials, because they will now make rules. They can, of course, make many rules, like now you have to close the whole hospital, you have to isolate everybody, you are not allowed to go out from the hospital. This have actually happened. It's actually happened that a whole small city had to be in quarantine. The city, for example, in Italy, could not leave the city. They had to live there. They were not allowed to leave this his city. So this quarantine has to be usually around 2 weeks. And why? As we said, many patients in average are asymptomatic for 1 week, but usually it can take also 2 weeks. And therefore, if you see that nobody was sick, fine, then you can leave. Then we know that these group of patients have not gotten the disease. Supportive care, this is of course in the hospital done, which means you get fluids, you are treated, this pneumonia, this lung infection is treated. Which type of disinfectant solution does not work against coronaviruses? With chloroxylenol does not work, benzalkonium chloride does not work, and chlorhexidine does not work. Chloroxylenol, benzalkonium chloride, and chlorhexidine does not work. So there exist many disinfectants that people think that, yeah, this will work. These things will not work. What is the proper use of the mask? Fitted tightly to the face. Okay, and as you see above there, I have a special type of mask which is having a small filter, not the one that we have down there, because this is a surgical mask down there. It does not work. People are buying this mask and it does not work. And the problem, as I said, surgeons cannot operate anymore because they cannot buy this mask anymore, because everybody buys this surgical mask in belief that this could protect them. No, you have to buy this specific N95 mask that is isolated, but the problem with that one is that you cannot wear it the whole day. You will not be able to do it because you will sweat, you will not get any air, and it's totally isolated. It's not worth it. Stay home if you need, if you can, if you have the opportunity, if there are a lot of outbreak in your city. Otherwise, go on and work, go to school, go to work, don't panic, okay? But if your city is affected, then you have to buy this mask, take a little bit care, and don't go out so much. Can't be touched. Don't touch your mask, okay? Change it immediately when wet or dirty. When it's wet, you have to change it, you have to clean it, and you have to disinfect it. Safe disposal in a container. When you have used it and you don't want to use it anymore, it has to be a safe disposal in a container, and this is very, very important. Hand hygiene after using the mask. Wash your hands. Remember, these are the things. When should hand hygiene be used? After contact with the patient or its environment, as we said. Then we have before and after preparing any food. Before eating, after the toilet, and whenever hand looks dirty. Okay? These are the cases when you have to wash your hand. And there are probably many more. I want to highlight these ones. With what do we wash our hands with? Alcohol, when it's not visibly dirty, and water and soap when it's visibly dirty. So you see down there is dirty head, then water and soap, otherwise alcohol sanitizer, okay? With what do we dry our hands with? Paper towels that are thrown away in this container. Paper towels thrown away in this container. How are you allowed to sneeze? So you cannot use the same thing for your whole family, okay? Not the same towels. So you have to have this paper towels. Good. How are you allowed to sneeze or cough? With mask, and not the surgical mask that this guy has, and not touching the mask with the hand, because it will go directly on the hand. In tissues, not so good, but if you have no other option, then you will do this, but then you have to remove this tissue into a safe container and wash your hands. In flexed elbow, this is also good, because if you're shaking hand with somebody, then you don't touch the hand with your viral hand. You have sneezed in your elbow, and this will not affect the other people. Always followed by hand washing, so please always rinse this with alcohol, as we said, or soap and water. Where should the container be located? In the patient's room. So we have a hospital and the patient is there. Always put everything in that room. The container, everything. Don't move stuff around in the hospital. How often should a patient's room and bathroom be cleaned? Once daily with disinfectant containing a diluted bleach solution. Once daily with diluted bleach solution. This has to be done in the patient's room. In how many degrees should you wash the patient's clothes in? 90 degrees. So not 30 or 60, 90 degrees. How do we know if the patient has recovered from the disease? First of all, there are no symptoms anymore. We don't see anything after, let's say, 2 weeks. there's 2 negative PCR tests at least 24 hours apart. Please remember that, not one. It can be a false negative. So you have to have 2 negative ones, 2 negative PCRs, and 1 day apart. Please remember that. Then you can say, okay, this patient is not sick anymore. We can discharge him. Which 2 medications have the potential to be good against coronaviruses? We have chloroquine and remdesivir. Chloroquine looks like this. This is used for other type of treatments. I will not deal with those today. And these 2 medications have been shown to actually be good against this virus, but it's not so good that it actually cures patients. And therefore, I cannot say that these 2 medications will be good for you. I can just say that some studies have to be done to say that this will actually work against coronaviruses. Chloroquine and remdesivir. Does vaccine exist against coronaviruses? No, but it's under development. So it's under development. And the interesting thing here, and once again, there exists already a vaccine against influenza, but people are not taking it. Now I would ask you, what if you knew that you had a vaccine available for coronavirus? Would you take it? Then I would say probably more than 90% of people would say yes. Why do more than 90% of people say no to influenza vaccine? That's my question. As we said, 48.8 million affected in the United States, more than 80,000 deaths in the United States, and there exists an influenza vaccine that is working. I can really assure you of it's working, because before that I always had influenza every year, and I had influenza sometimes for many weeks, so 2-3 weeks. Now I don't have anything. I take this vaccine, and it's yearly vaccine, and this vaccine is getting smarter and smarter because the scientists are improving that, because as you know, this is a race of viruses against humans. And unfortunately, I would say sometimes the viruses will win. In this case, in coronavirus, we don't have any tool against it, so we need to search for it quickly. Now, let's do a quick review. So coronavirus, the statistics, as we said, it's a pneumonia disease is caused here. The 2 most severe diseases can be severe acute respiratory syndrome, and this acute respiratory distress syndrome is there in about 30% of patients. It's very, very common, and the patients that requires mechanical ventilation is 10% of these. And remember, all these statistics are just averages, or you have to take it with some salt, okay? Middle East respiratory syndrome is also dangerous. These 2 syndromes are very dangerous. The incubation period is in about 1 week, but can be 2 weeks also. The patients that develop a severe disease, 20%, 30%, it depends which source you ask. So 20% or 30%, remember it's around 20 to 30% getting severe disease. The 3 severe outcomes being respiratory failure, being septic shock, and being organ failure. Then we have the types of patients dying from this infection is those who already have the severe disease or medical staff sitting next to this patient. In the city that it all began in is Wuhan in China, and it's possible to get this coronavirus if you travel there, or if you actually travel to areas now that are having this outbreak, or you are getting in contact with somebody who was there before. So please watch out. Ask everybody, have you been flying to Italy or South Korea or China in the last week or 2? What is being done at the airport to prevent this happening? We screen people. At the gate, we stop them. We screen the people, and then we will make a quarantine if necessary. The new virus that we have here is called 2019 nCoV, and as we know, coronaviruses exist long time ago. This is not a new virus, but this type is called this one. And this mask, as we said, surgical mask will not help you, so don't buy this. Okay, please don't buy it because the surgeons need it. Other types of coronavirus can also cause, of course, influenza. And this is one interesting thing. Let's say you are a patient, you get a lung infection, and then we take some tests, and it says it's a coronavirus. Yeah, but which type of coronavirus? If it's not this 2019 nCoV, it's the usual type, the other coronavirus that we had for many, many years, then you should not be afraid. You should not be stigmatized because you had a coronavirus. Of course, you can joke with your friends and say that you had coronavirus, but it was the other type of coronavirus which was not so dangerous. Okay? So remember that. All coronaviruses are not the same. Where were the first cases detected? In the seafood market, as we said, in Wuhan, China, and this virus were transmitted from animals to humans or humans to humans. We don't really know exactly how it was transmitted, but it can be from animals to remember. And it's possible to be affected with when you have a contact with a person, and usually the dangerous here is that we have a contact with somebody who looks healthy and you think that it's no problem, and then you get affected. And therefore it's very dangerous because you are like a paranoid guy here or girl, because everybody you talk to could have coronavirus, because 1 week is the incubation period and you never know who has this coronavirus. The subtypes of coronavirus as being alpha and beta. In this case, what we're talking about is the beta subtypes, and the viruses are called coronavirus because they have a crown-like appearance on electron micrographs. This is a 3D picture of that. And RNA virus is the largest known genome here in this coronavirus. So it's very interesting in that sense that we have to study it, we have to research it more to find out how to make a vaccine against it. When did the outbreak begin? As we said, end of 2019. Therefore we call it 2019 NCOV. How many people have been affected and died? 90,000 affected around, and 3,000 deaths, so around 3.3% death rate, which is very, very high. But as we said, compared to other ones, it's actually not so high compared to H1N1 or Ebola or Marburg and so on. But we have to take it seriously, of course. How did this coronavirus spread to the rest of the world? Due to air travel, as we said, and the percent that is coming from China is 99%, more than 99% from China. In comparison, if we, as we said, look at the influenza virus in the United States in 2018, we had 48.8 million people being affected, and 80,000 died from it in the United States in 2018 only. Is it possible to prevent influenza? Yes, please take this yearly vaccination that you have in the summer or in the autumn season. The symptoms when you have a coronavirus infection is fever, we have a cough, we have dyspnea, so difficulty breathing, we have myalgias, which is pain in your muscles, and fatigue. The diagnosis test and the lab test we do, that is a polymerase chain reaction, and the lab values that we can see is that the lymphocytes are getting fewer, so then we call it lymphopenia, fewer lymphocytes in the blood. And the specimens that we can take is from sputum, it's from tracheal aspirate, it's from bronchoalveolar lavage, it's nasopharyngeal swab, and serum, so regular blood. Then we have imaging. They do an X-ray and we will see bilateral infiltrates. In CT scan, we can see ground glass opacities, subsegmental consolidations, and multilobular consolidations. Treatments that we can do, please don't give glucocorticoids in viral infections because it can increase actually the mortality and delay the viral clearance. But there exist, of course, patients who have been smoking too much and they have COPD, and therefore they need the glucocorticoids, so the steroids. The treatment of this disease is immediate isolation in this specialized filtered room, if possible. Infection control measures, and these are, for example, that we place the patient in this negative pressure room. We have gloves, eye protection, and so on. We have safe disposal of the material that we're in contact with the patient. The transport is completely minimized. We have proper hand hygiene, and we have to call the public health officials and notify them about this, because this is a political thing also. And therefore, it's important that we politically and with the police and with everybody are cooperating in the team, and then we can isolate this virus. Supportive care will happen, of course, in the hospital. That is very important. The types of disinfectants that you should not work, it's chlorhexylenol and benzalkonium chloride and chlorhexidine. The proper use of the mask is that it's fitted tightly to the face with this N95 type of mask, and you hardly get any air with this, but this is the most efficient one with a filter. Then it can't be touched, so don't touch it. Changed immediately when it's wet or dirty. Safe disposal in a container. Hand hygiene always before and after using the mask. The hand hygiene should be used after the contact with the patient, before the contact with the patient, or anything around the material of the patient. Before and after preparing any food, before eating, after the toilet, and whenever hands looks dirty, please wash your hands. And we wash our hands with alcohol or with water and soap. Alcohol, you see if it's clean, and if it's dirty hands, then water and soap. We dry our hand with dry paper towels, and then we remove this in a container. You are allowed to sneeze or cough in the mask, but not this type of mask, as we said, in tissues, then in the container, in flexed elbow, and then disinfect or wash your clothes in 90 degrees, and always followed by hand washing. Please always follow by hand washing. The container should always be located in the room of the patient and not being moved around in the hospital. The patient's room should be cleaned every day with disinfectant containing diluted bleach solution. The degrees should be around 90 degrees Celsius, and we have to check if the patient have any symptoms after 1 to 2 weeks, if we want to rule out coronavirus, and we have to have 2 negative PCRs at least 24 hours apart to say that this patient is free of coronavirus. The medications that are being investigated now is chloroquine and remdesivir, and it has potential to be good against coronaviruses. The vaccines that we have is under development, and therefore I would say in this coronavirus epidemic, it will probably not be achieved that we get the vaccine. So, for more information about the statistics, please look at the worldometers.info/coronavirus, and there you will find a lot of statistics about in which region, in which city, how many affected, how many deaths, and this is updated. So whenever I talk about some numbers here, these will of course be changed tomorrow, the next day, and so on. So please be updated and have a nice day. Don't be afraid of coronaviruses. Just take care of yourself with hand hygiene and all the things that I said in this presentation, but don't be afraid of it. Work, go to school, and have a nice day. Bye-bye.